Are your favorite foods include pizza, pasta, breads, and cakes? Do you love beer or any malt beverages? If you can eat or drink any of this without experiencing discomfort, congratulations! You are not gluten sensitive.
Many health trends are becoming popular these days. Gluten-free diet is one of them. In this video, we will focus on a certain dietary plan. Now, what is gluten? Gluten is a protein complex primarily made of two main parts, glutenin and gliadin. It is commonly found in certain grains, particularly wheat, barley and rye. Gluten is responsible for the elasticity of the dough and the chewiness of foods made from wheat flour.
What are the foods that contain gluten? Gluten-containing foods include pasta, noodles, breads and pastries, baked goods, and beer. These are also foods that shall be avoided by people on a gluten-free diet.
What is the purpose of a gluten-free diet? A gluten-free diet was invented to manage the signs and symptoms of celiac disease and other medical conditions associated with gluten, such as the following. Celiac disease is a chronic digestive disorder in which gluten triggers immune system activity that damages the lining of the small intestine. Over time, this damage prevents the absorption of nutrients from food. Celiac disease is an autoimmune disorder. Non-celiac gluten sensitivity causes some signs and symptoms associated with celiac disease, including abdominal pain, bloating, diarrhea, constipation, foggy brain, rash, or headache, even though there is no damage to the tissues of the small intestine. Gluten ataxia, an autoimmune disorder, affects certain nerve tissues and causes problems with muscle control and voluntary muscle movement. Wheat allergy, like other food allergies, is the result of the immune system mistaking gluten or some other protein found in wheat as a disease-causing agent, such as a virus or bacterium. The immune system creates an antibody to the protein, prompting an immune system response that may result in congestion, breathing difficulties, sneezing and coughing.
What can gluten-free people eat? Patients who are gluten-sensitive can still enjoy a wide variety of foods. Here is the list of foods gluten-free people can eat. Quinoa, herbs and spices, vegetables, meat, all nuts and seeds, all vegetable oils, eggs, plain dairy products, fish, and beverages except beer.
How do you know if you are gluten intolerant? Gluten intolerance can cause widespread symptoms that may have nothing to do with digestion. Bone and joint pain, tiredness, bloating, iron deficiency anemia, diarrhea, weight loss, skin problems like psoriasis and alopecia areata, abdominal pain, headaches. Autoimmune disorders are the 10 most common symptoms of gluten intolerance.
Patients with non-celiac gluten sensitivity, who have ingested gluten-containing products, can exhibit irritable bowel syndrome-like symptoms, including abdominal pain, bloating, and fatigue.
What does gluten do to your gut? If your body can process gluten, it doesn't harm your digestive system. It does have significant issues on your gut when you are gluten sensitive or you are diagnosed with celiac disease. If so, it can cause an autoimmune response, which in turn can elicit dangerous levels of inflammation that can harm the gastrointestinal wall. It can also cause digestive upsets as the body tries to rid itself of the antigens. According to a randomized experiment, Vasquez-Roque and colleagues conducted gluten-containing diet and gluten-free diet patients. People on GCD had more bowel movements per day, greater intestinal permeability, and greater inflammatory cytokine levels compared to patients on a GFD.
Is a gluten-free diet right for me? There are 3 reasons to go gluten-free. To manage celiac disease. Gluten triggers the immune system to attack the small intestine. If you are diagnosed with celiac disease, it is advisable to strictly follow the gluten-free diet in order for the small intestine to heal and absorb nutrients. To control dermatitis herpetiformis. DH is a form of celiac disease that triggers the immune system to attack the skin rather than the small intestine. People with this disease should follow a gluten-free diet to reduce the risk of having intestinal cancer and avoid having painful rashes. To reduce symptoms of gluten sensitivity. This is not as serious as celiac disease, however, it may still bring discomfort to a gluten-sensitive person. Gluten-free diet must be followed in order to avoid diarrhea, irritable bowel syndrome, and constipation.
Gluten-free diet is not for everyone. These are the 3 reasons not to go gluten-free. To eat healthier. In a healthy diet, an individual must consume at least 55 to 60% of carbohydrates where gluten is found. Cutting these kinds of foods will result in lack of fiber, vitamins, and carbohydrates that our body needs in everyday life. To lose weight. Gluten-free diet is not the solution to losing weight. It is expensive and there are a lot of options to choose from if a person really wants to lose weight. To diagnose your own symptoms. If you think that you are gluten intolerant, you must seek and consult a doctor instead of going gluten on your own. The blood test used to help diagnose celiac disease and DH depends on finding an antibody to gluten in your blood. If you have been avoiding gluten, the antibodies may not show up in your blood test, which could yield a false negative. What are the advantages and disadvantages of gluten to gluten-sensitive people? Gluten-free diet poses advantages and disadvantages to gluten-sensitive people. Advantages of this diet includes improves energy levels. People who have often suffer from chronic fatigue. This is because consuming gluten products damages their intestines, which in turn impairs the absorption of several nutrients including iron. This iron deficiency leads to anemia, which results in debilitating fatigue and exertion intolerance. Switching to a gluten-free diet will give your intestines a chance to heal, and this will restore nutrient absorption and improve your energy levels. Promotes healthy weight gain. The symptoms of celiac disease and gluten intolerance include diarrhea, bloating, gas and fatigue, which can seem rather vague and so the condition can go undiagnosed for decades. This results in nutritional deficiencies and in many cases, severe and uncontrolled weight loss. A gluten-free diet will help you regain lost weight as well as eliminate these nutritional deficiencies. Reduces the frequency of headaches. Over the last couple of decades, scientists have discovered that the gut and brain are closely connected, and there are several studies underway to discover the exact implications of this gut-brain connection. It is clear that people with gluten intolerance and celiac disease are more likely to experience migraine headaches. However, studies show that switching to a gluten-free diet can help to reduce the frequency of these headaches. Reduces joint pain. Since celiac disease causes an abnormal immune reaction, it increases the risk of inflammation. This is why joint pain, especially in the knees, back and wrists, is a common symptom of celiac disease. A gluten-free diet will help to prevent this type of joint pain, but take steps to ensure that you do not ingest even a small amount of gluten, as it can result in a recurrence of your symptoms. The disadvantages of gluten-free diet are reduced carbohydrate intake. Since there is no proper education when it comes to gluten diseases, it is sometimes mistaken that foods rich in carbohydrates contain gluten. Thus, this results in less intake of carbohydrates, which our body needs. Lack of fiber. It is known that some foods with fiber can result in abdominal pains and problems to people that are gluten sensitive. However, lack of fiber can also lead to some digestive issues. Weight loss. It is necessary to monitor the foods that gluten-sensitive people will consume. This leads to taking control of everything that they will put in their mouth, but this can also cause weight loss due to the lack of nutrients that the body needs. Going gluten-free diet, even without medical reason? According Dr. Andrew Chen, an associate professor of medicine at Harvard Medical School, said that the rest of the population should not think that going gluten-free will help their health, at least not their heart health. Dr. Chen and his colleagues analyzed data on nearly 65,000 left women and more than 45,000 right men, all U.S. health professionals without a history of heart disease when the study started. It appeared that those individuals who consumed the lowest levels of dietary gluten had a 15% higher risk of heart disease, Dr. Chan said. Eating gluten-free is a big fad right now, said by Dr. Ravi Dave, who is a cardiologist and professor of medicine at the University of California, Los Angeles Geffen School of Medicine. There is a lot of hype about how gluten produces inflammation and can lead to giving you diabetes, heart disease, dementia, a lot of things. Although he finds this new study inconclusive, Dr. Dave agreed with the researchers. We should not recommend people who don't have gluten sensitivity or celiac disease go on a gluten-free diet, he said.
Does a gluten-free diet have an effect on our social and emotional aspects of life? Social impact. Emotional impact.
There goes our discussion about gluten-free diet. There are a lot of things you need to consider before going gluten-free, so make sure to consult a medical doctor before going on a gluten-free diet or any dietary plans. We hope you learned something from this video. Thank you so much for watching.